The power of mental endurance. From losing a hero, med school, and weighing at 300 pounds, and a plot twist, Kevin Gendreau, from fasting while furious, took his anger and sadness and turned it into motivational weight loss. Thank you for being here, Kevin.
Thank you for having me.
So take us to the time that you gained all the weight and what was going on in your life.
All right, so I guess we could start with childhood. I had a pretty uneventful childhood. I was super active. I had a very diverse diet. My mother is Portuguese. We're from Fall River, so I ate a lot of Portuguese staples growing up, but also lots of fruits and vegetables. I was very active with martial arts with my father, and I would say from ages 0 to 17, everything was pretty status quo. At age 17, my father was diagnosed with metastatic melanoma. There was a mole on his back that was blackened and very necrotic, and it actually fell off while we were at an amusement park. He was going down a slide, like at Water Whiz, and his mole fell off and it started profusely bleeding, and so he went to the doctor to have it checked out. By the time he had the mole removed and the tissue surrounding the mole removed, he was diagnosed with melanoma, and with each successive surgery that he had done, they found that the cancer had spread further and further. So it had spread to his lymph nodes, and then we found out that it had spread to his lungs and his liver and his brain, and so he underwent surgery, radiation. Even at one point he had radiation to his brain. He had multiple rounds of chemotherapy, and so unfortunately, with each time we found out news about his health, it was negative. And so between the ages of 17 and 18, I really started to eat my feelings while I was dealing with his cancer diagnosis and then ultimately his passing a couple of years later. And at this point in my life, I was actually in the early stages of being pre-med at Boston University. And so I was on the path towards becoming a doctor already, and this really solidified my desire to want to help people, and in particular, my desire to want to be a part of preventative medicine. And I wasn't sure at that time if I wanted to do something like dermatology with melanoma or if I wanted to do something like family practice. So throughout the rigors of my undergraduate education and in dealing with my father's passing, I slowly but surely put on lots of excess weight. And so instead of the freshman 15, I usually say that I gained the freshman 50. And then it actually ended up being more like in excess of 120 pounds. So I went from 180 pounds to 306 pounds over the course of like 5 or 6 years.
So how did you feel like lugging all that extra weight? And did you also experience any kind of discrimination for being overweight?
That's a great question. I feel like as a cis white male, I have like this privilege that other people don't have, and so even though I was overweight in medical school, I really didn't face too much discrimination. I actually think that I faced more discrimination for being gay than for being overweight. But when it comes to like the day-to-day, there were just like a few jokes during medical school, nothing groundbreaking when it came to like life-ruining comments or anything with respect to grades in medical school or reviews on rotations or anything like that. The real issue, I would say, that negatively impacted me were medical. So it was all medically related diagnoses and also just like mental health. So for example, by the time I reached 306 pounds, I was actually completing residency. So I was a board-certified family medicine physician. I was an MD, and I was treating patients as a 306-pound doctor who was diagnosed with type 2 diabetes, obstructive sleep apnea, fatty liver disease, high cholesterol, high blood pressure, plantar fasciitis, depression, anxiety, I mean, a lot. So I had to give people advice.
Yeah.
And I wasn't really taking any of that advice. And so it was really hard to like have a person in front of me who was like 240 pounds or something like that. And I had to tell them to to watch their diet while I was over 300 pounds. So it was really hard to provide advice to patients. That was like the most difficult part, other than dealing with all of these comorbid conditions from being overweight.
But on the other hand, you must have had patients that preferred to be with you because you understood at some level that it wasn't an easy solution to just, okay, now you're going to lose it. So it kind of seems like you may have had some that probably was like, oh, who are you to tell me? And then there's this other connection. Thank God there's someone like me.
Right. I think that's true. It's two-sided. So I think people now, when I see patients, I definitely share my story with them to try to help inspire and motivate them. And back in the day, there were definitely the types of patients, there were quite a few male patients who were like, what do you mean you're telling me to lose weight? Like, don't you need to take your own advice? Which, like, I just kind of brushed it off as no big deal at the time. And I think there were some that appreciated it, because there are people who are born genetically blessed, you know, can eat anything that they want, basically born with a six-pack, can eat a dozen donuts and stay skinny, and those type of people I can't even relate to, and certainly my patients can't relate to people like that.
Neither can I.
So,
Neither can
I mean, it must be nice.
No, neither can I. So do you think a lot of the weight gain is really emotionally than it is genetic? And if so, what would you say the percentile is, if you do know?
Yeah, so it's a really difficult thing to quantify in terms of like percentages of emotional eating or say disordered eating versus like how much of that is genetics. I think in my own years of experience treating patients with obesity and all of the comorbid conditions that come with it, I would say that it's probably some kind of genetic component that you're predisposed to, like insulin resistance, for example, and then certain things that you're eating, certain behaviors that you have, inactivity versus activity, and then like dietary choices are really impacting that. So the way that I like to describe it is your genetics load the gun, and then your diet and your lifestyle choices are pulling the trigger. So at any point you can pull the trigger by doing the wrong things with your diet and exercise, but if you basically you can walk around with a loaded gun your whole life and never pull the trigger by acting in a way that you are aware of your insulin resistance, you're aware of your genetics, and so you have to eat differently than other people.
So what was the hardest part of your journey? What was the challenge when you had all this weight, the pressures of life, med school, and what was the most difficult and challenging part of it that maybe gave you some setbacks? Because they had to have been some setbacks, I'm assuming.
Yeah, so I think everything really came to a head in August of 2016. At that time, my sister was diagnosed with cancer, and so this was the second major person in my life to be diagnosed with cancer that I had to deal with, and her journey, unfortunately, was very similar to my father. So he was in his 40s with being diagnosed. She was only 31 at the age of diagnosis, and she also has two small children, my niece and nephew, and so hearing of her diagnosis and learning of it, and then starting to see her go through this same journey of surgery after surgery, radiation after radiation, chemo after chemo. At one point, she had to be admitted to Brigham and Women's Hospital with the Dana-Farber cancer team for stem cell transplants, which was more on the experimental side with immunotherapy and radiation and chemo combos, and like all of this stuff that I wasn't even aware of as a doctor. And having to see her go through that, I started to view my journey and diagnoses, all of these things like the type 2 diabetes and the fatty liver, and the high cholesterol and the blood pressure, I saw it as a choice. Like I was choosing to eat the wrong foods. For example, I would start my day with cereal, have sandwiches for lunch, pizza for dinner. Those choices that I was making was like I was pulling that gun every single time that I had to eat something. I knew my genetics, I know that there's diabetes on both sides of my family, and yet I was still choosing to eat the wrong things, and I knew that it was leading to those diagnoses. So I saw my whole path and my whole trajectory as a choice, whereas she was just doing whatever she had to do to survive for her kids. So that seeing that and enduring that as her brother really inspired me to make a change, and it was a lasting change. So this was like August 1st of 2016. I woke up and I decided to just choose differently. I threw out all the processed foods, all the carbs, all the sugars in my house. I decided to eat really clean and low carb, and the weight started coming off very quickly. And so over an 18-month period, I went from 306 pounds down to the 180s.
Now you talk about is the low carbs and fasting. So does that program, that weight loss program, would you say that fits everyone?
No, so I wouldn't say fasting fits everyone. I would say the majority of patients who come to see me have insulin resistance, so they have that similar body type that I have. And so I see them, I measure labs like hemoglobin A1C, triglycerides, LDL, HDL, LFTs, which is liver function test, and you check things like AST and ALT to see if people have fatty liver. So I use these metrics to show, is this person insulin resistant? Do they have this body type? And if so, I know that a carb-reduced diet is the best approach for them. So I really focus heavily on lifestyle, and even though I am an MD and do prescribe medications for weight loss, I view things like medications, intermittent fasting, activity, other things like mental health, sleep, water intake, etc. All of those are like accessory tools for weight loss, but the baseline, most important intervention that I talk to people about is focusing on protein, healthy fats, and fiber, and trying to minimize processed foods and refined sugars. Because those are really, if you're insulin resistant, those are really the triggers for weight gain, because they cause increased levels of insulin, and insulin is like the weight gaining hormone.
But did you apply fasting to your path?
I did, and the name of my book is Fasting While Furious. So that's kind of like a catchy title, but at the end of the day, the most important intervention that I made personally was low carb. So intermittent fasting actually came in at a later time for me. So I did low carb, and then after about, I would say when I got down to like 230 pounds, so I had lost 70 or 75 pounds, I read a book called The Obesity Code by Dr. Jason Fung. He's a nephrologist that runs a company called The Fasting Method in Canada. And even though he's a board certified nephrologist or kidney specialist, he has switched over into this expert in intermittent fasting, and he's written many books on it, The Diabetes Code, The Obesity Code. And after reading that book, I was inspired to start fasting as well. And that really got me off the plateau. My weight loss plateau happened right around my sister's passing, which was in 2017, in June of 2017. So I'd lost quite a bit of weight. And then when she passed, I kind of went into survival mode during the time of her being in hospice, and then just after passing. Yeah, the stress.
The stress contributed to you just plateauing.
For sure.
Isn't that amazing what stress can actually do? And
I know.
Yeah.
It can be measured. I mean, we know that cortisol goes up when you're stressed. Cortisol is the stress hormone. We also know that ghrelin, which is the hunger hormone, is released when stressed. Cortisol and ghrelin are also released for people who work third shift. So if you're overnight and you have like sleep dysregulation, those hormones are released. There's a lot of things that release them, but in particular, when you're under any kind of duress, whether it's like anxiety or some kind of personal stressor, like I was losing my sister, or maybe you're in the middle of a move or a divorce, any kind of things like that, you can have a release of cortisol and ghrelin, and there's a lot of different gut hormones that are involved in stress, which is, I mean, people talk about all the time, like the GI tract and the gut is actually linked to stress. So people have IBS or irritable bowel, they have nervous diarrhea. It is like, it's all really connected.
Amazing. That is good to know. Now, the other thing that I want to zone in more is in your book, what prompted you to say, I have to write this book? And talk to us a little bit about that. What inspired you to start your book?
That's a really good question. I don't think anyone's actually asked me that.
No.
No, I would say what inspired me is the patients that I see on a day-to-day basis. So at this point, I've seen thousands of patients for weight loss. I switched from primary care into obesity medicine full-time, so that's my full-time job.
I love it.
So my full-time job is helping people lose weight now, and in doing that, you know, I have shared my story with patients, and I know that it's motivating and inspirational when you hear that your physician has done what you need to do. Just knowing one other person has done it makes you more likely to do it. And I know that I help by holding people accountable. I see patients every 6 to 8 weeks. And so I thought maybe if I shared the intricate details of exactly how I did this, why I got motivated and inspired myself, maybe it would help someone else. And so I can only help so many when it comes to the outpatient setting and seeing patients day to day.
Exactly.
I usually see 18, 20, maybe
That's
25 patients in a day, but
that's a lot.
having a book that you can publish online and kind of just like share the story, there's people across the country who could be inspired.
And what I love about your book is not just that you share those moments in your journey, but also you have really great recipes.
Thanks. Thank you.
You do. I was like looking at them, and my friends was like, "Oh, I'm going to try this, and I'm going to try that." So that's a great starter for someone who's not sure where to start. You know what I mean? So I think you do a little bit. Do you do a little bit of ketos? Is that?
There's a lot of overlap.
Yeah.
So keto is very specifically a high-fat, low-carb diet. So the low carb is the same.
Yeah.
The difference between what I do and keto is keto has a huge focus on like 80% of your caloric intake from fat, whereas I just talk about lowering your carbs, and that means increasing your fat, increasing your protein, increasing your fiber, but not necessarily eating bacon and butter and steak and cheese all day. You can have those things, but it's more about increasing things like meats and vegetables overall, and not just specifically fat to 80% of your intake. People who follow keto also, they'll use like urine sticks or blood tests to get themselves into ketosis, which is a weight loss, fat burning state that your body gets into with weight loss. But I've found in my own clinical practice and anecdotally with myself and family members that you don't need to be in ketosis specifically. You just have to have a reduced carb diet. If you have an insulin resistant body type, reducing your carbs will lead to weight loss. And in particular, patients of mine in clinic see a 7 to 10 pound weight loss per month. So they do really well without having to actually pee on a stick and check if they're in ketosis or not.
So with the mental aspect and the emotions, how are you maintaining all of this to where now it is you? This is who I am, because it must have been hard to cross to that point where you must still be at that point when you're trying to be steady with your eating clean. You have to experience triggers, I would assume. It's almost like you're detoxing.
Yes. So there's a huge food addiction component and a food addiction model, sugar addiction model to this. And I talk to my patients a lot about it. There's a lot of mental health that goes into this. First of all, I think what's really important to note is if you drop 15% of your total body weight, there's an 80 to 85% improvement in mental health. So my own mental health, my own issues with stress, depression, anxiety, binge eating disorder, 80 to 85% better, I would say that sounds about right. With my I lost more than 15%, but once I dropped 15%, I would say it was at least 80% improved. So not perfect, not 100%, but much better. And that number is definitely something that I've experienced with patients, where as they drop the weight, they're actually able to come off of SSRIs, drugs like Celexa or Zoloft, which is amazing. Like they're improving metabolically with their blood pressure and their fatty liver and their diabetes, but they're also improving mentally. So that's something that I experienced. That's something that my patients experience. And so our goal is a 15% body weight loss at least within a 6 to 12 month period. And the patients do really well with that. And then they benefit from a mental health perspective. With respect to like my own mental health, it's not always perfect, but I think it's more about like progress and not perfection. And how many times you get in the car and you go to the store and buy a box of Oreos and binge on it. Is it twice a week? Because if it's twice a week, it's not controlled. But if it's a couple times a year or once every 3 months, you're not going to gain all of your excess weight back just from that. Like it's pretty much under control or mitigated to a point of it being achievable or sustainable over time. For me, it's been like 7 years. And so as long as it doesn't happen too often, it's okay. You have to forgive yourself. Like part of this whole process has been learning to forgive myself and accept myself for who I am and love myself despite slip-ups, because slip-ups of course happen.
It happens.
It happens. And
We're
so
human.
How fast do you get back on track? Is it that you're going to beat yourself up, or is it just like later that day? You know, an easy thing to do is say like, oh, it's like, I'll just start on Monday, or I'll just start August 1st, or I'll just start after that wedding, I'll just start next week. Like, you could say that forever until you're dead. You have to pick a point at some point. So with myself, I've always said, like, later that day, I have to get back on track. Not like, oh, tomorrow or oh, Monday. The same day. If I go and eat a croissant that same day, I'm gonna make sure that I exercise, and that dinner that night, I'm gonna eat normally. Like, normally for me, which is protein, fat, and fiber, and healthy, and feel satisfied and satiated, and not punish myself for it.
And do you have to live in the gym, or do you just be active and getting the exercise in different ways?
So I'll never be a doctor that says you have to, like, that you don't have to work out, because of course,
yes.
I mean, as a physician, you're supposed to tell patients to work out. But like I was mentioning earlier, intermittent fasting, medications, exercise, all of those are just like ancillary tools. They're not necessary for starting to lose weight. So the most important intervention is like the low carb, the focus on clean eating and proteins and fats and fibers, getting rid of the processed carbs and sugar, things like bread and cereal and pasta and rice and chips and cookies and crackers, all the good stuff.
Oh my.
I know. But the formal recommendation for exercise is 150 minutes a week of moderate intensity exercise.
Okay.
So you could do like 3 50-minute sessions per week of moderate intensity exercise. So not just walking, but something beyond that, like biking or swimming or jogging, or if you're gonna walk like uphill, walking at a vigorous pace. And 2 days a week of 15 to 30 minutes of strength training. So that would be the ideal recommendation. 150 minutes a week of moderate intensity exercise of some kind, 15 to 30 minutes twice a week of strength training. You can actually split up the 150 minutes into just 2 sessions a week. So if you're a super busy person, you can do 2 75-minute sessions on the weekend. You can do Saturday 75 minutes, Sunday 75 minutes. They've actually done randomized controlled trials on weekend warriors,
wow.
which is people who work out just on the weekends. And they have a very similar cardiovascular improvement and mortality benefit from even just working out on the weekends. You don't have to split it up throughout the week.
Oh my goodness. So, your book, how can they get the Fasting While Furious? Where can they go and get their copy?
So it is available on Amazon. It's just my story. I'm really like not interested in, you know, a get rich quick scheme. It's just like a way to maybe help pay some of my student loans off and a way to share my story with everyone.
And you wrote some other books as well.
I did. So back in 2012, I wrote A Healthier You with Sophia and Sue. This was actually when I was in medical school.
Oh, wow.
I've always had a passion for creativity. I love kids. So my niece Sophia is one of the stars of the book.
Nice.
And it's just like a rhyming little adventure story. And this is also available on Amazon and Mascot Books.
Beautiful.
And then I have a book that I published in 2018 called Queen Celine's Vaccine Machine.
Ooh.
And this was actually prior to the COVID-19 pandemic, so it doesn't include like any vaccines about COVID, but it's basically about the childhood vaccines. It's an adventure story, like a very whimsical, rhyming adventure story for kids. And yeah, I wrote it with, you know, Sophia and Henry, my niece and nephew, as the protagonists, and so that was in 2018. And then I actually also brought a copy of my newest patient handout. So it's a 60-page handout that I provide to my patients that has an introduction to metabolic health, all of these weight loss resources. There's about 100 recipes in here now. And I also have an introduction to intermittent fasting and a weekly wellness tracker. So I brought it just for you to check out.
Yeah, let's show the cover. Look at that. How grand is this? So, what's your advice to everyone who is doing their best but they feel like it's not enough?
Okay, so that's a difficult question.
I know it is.
But I think one of the biggest issues is people think they're doing their best and what they're doing is old weight loss advice. So advice, if it's from the 1970s, say, right? If it's from the food pyramid era, is going to tell you low calorie, Weight Watchers, portion control, low fat, and all of that diet advice is very antiquated. It's super outdated and it's not really accurate with respect to metabolic health and insulin resistance. So I would say the best piece of advice that I have is you have to figure out your body type, and if you have elevated liver function tests for fatty liver, if you have PCOS, if you have prediabetes or diabetes, if you have high cholesterol or high blood pressure, then you very likely have metabolic dysfunction, metabolic syndrome, or some form of insulin resistance. And if that's the case, the best dietary intervention is to go low carb, to reduce your carbs, reduce your sugar, increase your protein, increase your healthy fats, increase your fiber. Try to get out of this like low fat, calorie counting, old mindset that so many people are in. The vast majority of the patients that see me have that mindset, and they're like, I can't believe you're like blowing my mind right now telling me not to count calories. But it's because it's very, very old fashioned, and it's treating the human body like a calculator. And we know that the human body is a complex biological hormonal system that changes so much with age, changes if you have a kid, changes with menopause, changes with so many ways throughout your life. And so to treat us all like we're just an individual calculator, calories in, calories out, is like pointless. And so we know so much about obesity, about the human body type, the way things work, the inner workings of the body, things like insulin and ghrelin and leptin, all of these hormones. And so why not learn more about insulin resistance, learn more about your body type, and then treat that body type appropriately?
Because not all fits same size. Yeah. It's like, I think society, we're just so used to having, you know, one uniform, all, you know, everything fits one, and we don't. Everyone's different. So that is really great. So thank you for being here and educating us to a better way of thinking, being, and living. Thank you so much.
Thank you for having me. I appreciate it.
Yes, I love it. Thank you.